Welcome, everyone. Hi, I'm Naomi Boak, and I want to welcome everyone to It's Not Just Polar Bears, the Climate Crisis and Your Health. Our special guest this evening is Dr. Barbara Erny, and this event is brought to you by Stanford Alumni for Climate Action, and we're a subgroup of Stanford alumni in sustainability. And I'm very happy to welcome everyone in the Stanford community, friends of those of us in the Stanford community, and especially students, because now students and alumni can talk together in events, and I think that's really important. So welcome. So I am Naomi Boak. I'm class of 74. I am a television producer turned park ranger at Katmai National Park in Alaska. Part of my history is that I've done a lot of medical television, documentaries about Alzheimer's and television series for a medical professional audience. So it's been a real pleasure to work with Dr. Erny on this presentation. And Barb Erny is a native Californian. She got her BA from Cornell and her MD from Stanford. She's an adjunct clinical associate professor at the medical school. She's been spearheading efforts to integrate climate change education into medical school curriculum, which I think is really important. And if you look at any recent medical journals, there are more and more articles and research about the impact of climate change on health and medical practice. Dr. Erny is editor of the Journal of Climate Change and Health and a member of the Climate Action Working Group for International Agency for the Prevention of Blindness. She also serves on the steering committee of the Medical Society Consortium on Climate and Health and the Global Consortium on Climate and Health Education. And boy, are we lucky to have her at Stanford and very lucky to have her this evening. Before I let Dr. Erny take over, just some boilerplate. Dr. Erny's presentation will be probably 40 minutes or so, and because we want to leave time for your questions, please put your questions into the chat. And then since we probably won't have time for questions from all of you, we're going to collect questions and get to as many as we can from the chat. And please keep your audio muted during this. You can leave your video on so we know that there's an audience there, and we're not doing this alone. And Dr. Erny, welcome. Yeah.
Thank you. I'm just sharing screen here. The climate crisis is a health emergency. Imagine you're a patient in the hospital that's flooded from a hurricane, or that you're asked to help evacuate critically ill patients with an impending wildfire coming. Or you find yourself in a shelter after you've lost your home and your business, and you have injuries and high anxiety because you can't locate all your family members. These are real scenarios showing that the climate crisis is affecting your health. It's not just the polar bears anymore. So thank you for coming. I'm Barbara Erny, and thank you, Naomi, for that nice introduction. So the WHO and Lancet have declared that the climate change is the greatest threat to global health in the 21st century, the greatest health problem of this century. So this is very serious. And in fact, as Naomi mentioned, I'm helping to teach this to medical students because we have to get this taught at all medical levels. In fact, the New England Journal of Medicine, along with 230 journals, have warned us that even going up to the 1.5 degrees Celsius goal of global warming could be catastrophic for our health. So they're calling us to action as physicians to bring this up as a health issue. This isn't just costing lives, this is also costing dollars. WHO's estimating that it's costing us 2 to 4 billion per year by the year 2030. And of course, deaths and injury mortality are going to soar between 2030 and 2050. But not everyone is equally vulnerable to the impacts of climate change and health. Particularly vulnerable populations are exemplified by this woman who's elderly, a person of color, disabled, chronically ill, and impoverished. Children are also at higher risk for health effects from climate change. And I think we've all heard stories about those outdoor workers who died last summer from the heat. We have also very vulnerable communities just right across the 101 freeway from affluent Palo Alto and Stanford resides East Palo Alto, which is a city with poverty and poor infrastructure and public planning. There are a lot of people there with undertreated medical conditions, and they are experiencing sea level rise, and they actually have more air pollution than we do on the other side of the freeway due to the winds. It's estimated that 50% of East Palo Alto will be underwater permanently by 2050 if we don't change something. This is Sarah. She's a woman that lives in East Palo Alto, and last summer her asthma was out of control because of the wildfires added to the normal air pollution. Finally, that was getting better, and she found out the good news that she was expecting a baby. However, during her pregnancy, the floods came to California, and her car was destroyed in the garage in a flood. She was unable to get to her prenatal appointments and had disruption in her medical care. After she had the baby, she had post-traumatic stress disorder from all she'd been through from the climate events and ended up talking to a counselor. I'm going to tell you now about some more of the impacts of climate change on human health using this schematic from our Centers for Disease Control. Basically, this is a nice graph I find to show you that things like severe weather are leading to injuries. Air pollution, which is both a cause and effect of climate change, is causing more asthma and cardiovascular disease. We have changes in our insects and animals causing more infectious disease spread, of course, increased allergies, poor water quality with diseases happening from that, malnutrition from water and food supply impacts. We have forced migration and civil conflict from the environmental degradation. And the extreme heat is very worrisome for causing heat-related death and cardiovascular failure. Looking at heat, maybe some of you remember in 2003, the heat wave in Europe, where over 45,000 people died in just 11 days. Later studies showed that the total was really 70,000, taking into account effects that happened afterward. So let's say your mother is calling you to tell you she's not doing well, but she lives 2,000 miles away. Betty is an 83-year-old with heart disease and chronic kidney disease who lives alone, has no air conditioning, has poor mobility and no transportation of her own, and the heat index outside is 107 degrees. What can you do? Well, you can be aware of these conditions causing heat stroke, as Betty had, the no air conditioning, but maybe you have air conditioning, but there's a power outage. People tend to wait too long to seek help, and then they get confused and then don't seek help. Many elderly are living alone. They have nowhere to go. Maybe they get dehydrated. Pre-existing conditions are exacerbated. Many medications can actually cause people to have heat stroke at a lower body temperature or more easily, including psychiatric medications, especially those for treating ADHD. So kids who are out playing soccer in a hot field or practicing sports and are on these medications are more prone to heat stroke. Diuretics and even antihistamines can make you more prone to the heat. Certainly people that work or play outdoors are very exposed to heat stroke. So maybe you could save someone's life if you knew the signs and symptoms of heat stroke. This occurs when someone's core body temperature gets above 104 Fahrenheit. But as I said, with certain medical conditions or even medications, it could happen at a lower body temperature. Someone might have a throbbing headache and feel dizzy, have nausea and vomiting and confusion, even leading to seizures and unconsciousness. This person would have a rapid heart rate and respiratory rate. And the key is the skin is red and hot, but it's dry. Normally when we're hot, we sweat a lot, should be wet, but in heat stroke, the skin is dry. So you could save someone's life or your own if you recognize these symptoms. So we're going to just have some fun now and throw in some questions just for people to participate in the talk. We have a question here, and you can put your answers in the chat. You can just put in A, B, C, D, E in the chat as I'm reading off the questions, and we'll take a look at that. How has climate change affected the frequency of West Nile virus infections? A, altered mosquito habitat. B, altered bird habitat. C, increased breeding and survival of mosquitoes. D, increased frequency of biting of mosquitoes, or all of the above. So go ahead and just pop a letter in the chat. Naomi's going to take a look at that.
Well, it's a typical smart Stanford group. They all say E.
Yeah, it's always E when E's all of the above. So that's you guys.
We've taken too many tests in our lives.
Yep, multiple choice. Yes, the answer is E, all of the above. So the mosquitoes actually bite more when it's hot out, and we have increased breeding and survival with the increased heat. I grew up here, and West Nile virus was not a thing until after 2000, I think. So I never even saw a mosquito as a kid living here. But these zoonotic and vector-borne diseases are spreading. They're being introduced to new places with increased geographical range. Even Lyme disease is now in Canada, and it never has been before, but it's gotten warm enough for that. There are prolonged transmission cycles of these diseases and reemergence of diseases. Dengue is again endemic in the US, and malaria cases were being transmitted here in 2016 without travel. Something you can use to protect yourself against these mosquito-borne diseases is to use a repellent. The CDC recommends Picaridin. It actually works a little bit better against mosquitoes, and it is safer than DEET. Also wanted to share with you some of the effects of climate on food. So the rising global temperatures and changes in weather patterns, along with the rising CO2 concentration, are causing some changes in our food systems. Temperature and flooding can lead to increased pathogens or foodborne illness. Climate can also alter weed, insect, and fungal populations, leading us to increase our petroleum-based pesticide use. Something really I found very fascinating is that the rising carbon dioxide actually kind of fertilizes the soil, and it causes plants to grow more quickly and to deposit more carbohydrate than protein. So for our staple crops in the world, like wheat and rice, of which many, many people are dependent in their diets, the protein content is going down, and this could be a severe malnutrition issue in the future. Warmer temperatures can also result in greater food spoilage, and extreme weather events can disrupt food distribution to any of us. But what about the effects of food on climate? The US food system, which consists of everything about the food system, agriculture, packaging, and transportation, is responsible for 37% of the total greenhouse gases in the US. Now, we hear a lot about transportation being the #1 issue with greenhouse gases in the US, but food is right behind it. So we need to talk a little bit more about food, and food affects our health directly too. Something is beef and red meat has 20 times more greenhouse gas emissions per gram of protein than plant protein. Cows actually burp the methane. And that has been shown to be associated with heart disease, cancer, and even surprisingly, diabetes. So for you to learn more, really in a fun, quick video about sustainable diet, the Harvard School of Public Health has this Gaples Institute, which has put out this video, which you'll have access to all these websites later, on how you can eat to support your health and planetary health. But our dumbest problem with food, or it's just our dumbest problem, period, in my opinion, is that America wastes 40% of its food. That's edible food. We could feed 25 million of the 54 million food insecure and malnourished people in the US with that food. And most of it comes from us, the consumer. Now, globally, it's other reasons like politics or lack of labor or just all sorts of things that can affect the food supply. But in the US, it's us, the consumer. And this is responsible for 9% of total US greenhouse gas emissions. I would like to see that number go to zero pretty easily, I think, if we all tried. So we're going to just throw in another question, and I'm going to tell you one thing I learned about multiple choice is B tends to be the most common answer. But with that said, I'm going to give you the trick question here. Which of the following is not true, which also makes it a trick question, not true regarding the effect of climate change on airborne allergens? A, allergy seasons start earlier and end earlier. Please vote in the chat. B, pollen is becoming more virulent. C, plants release more pollen per flower. D, allergy seasons are increasingly overlapping. Or E, allergens more easily irritate the lungs.
Okay, we've got some mixed answers here. It's not unanimity, but I see a lot of A's from our audience.
All right. Again, the smart multiple test takers. Yes, allergy seasons are actually starting earlier and ending later. So there's more overlap now. Someone who may have just had a couple months in the summer and a couple months in the winter now maybe has it all year long. Pollen is becoming more virulent, which is very interesting. The cell walls are changing from the heat and actually break down more easily. The pollen that's actually stronger. That's the cell wall breakdowns causing more pollen to be released per flower. And these allergens are more easily irritating our lungs because our lungs are already irritated from the air pollution. So looking at that, we already talked about the increased CO2 changing plant metabolism for our food. It's also in making the allergies worse. This increased heat is also causing more air pollution problems because it traps the ground level ozone so that we're breathing the ozone rather than having it up in the stratosphere where we need it. And of course, increased temperatures are leading to more wildfires and we're breathing that smoke. There are, of course, increases in allergies and asthma, but even people with normal lung function are experiencing decreased lung function from these pollutants and pollen. So something else that's staggering to me is that fossil fuel combustion, again, a cause and effect of climate change, is responsible for greater than 8 million deaths per year globally. Now, we were all pretty shocked and upset when COVID caused 1 million deaths in a year, but this is every single year, and every single year it's going up. These deaths from air pollution, which isn't really talked about. Most of these come from indoor air pollution, from insufficient biomass and coal cook stoves, or inefficient, sorry, and then outdoor air pollution from urban exposure is a little under 4 million a year. But 137 million Americans are living in places with unhealthy levels of air pollution. And most of us in our homes, there's 5 times more air pollutants inside our homes than outside. One of the reasons for this is actually our gas stoves. So the Stanford Woods Institute for the Environment ran some studies looking at gas stove leakage, just leaking chemicals and gases without being even turned on, and then what is being emitted even when the flame is on. And this is nitrous oxide, which can cause respiratory infections and asthma, even decreased cognitive functioning. Carbon monoxide, which we know can kill us, particulate matter, benzene, which is a carcinogen. So if you do have a gas stove, open a window and use the hood for sure. Try to cook on the back burners. And if you can, switch to an electric induction stove. I have a plug-in induction burner that's great. I use it outside and could cook outside in the summer and not generate any heat, or cook garlic and onions and not smell at my house. So it's really a great thing. So that's a way to give it a try. And also with air pollution, we're seeing this increase in wildfires, especially here in the West Coast where I am in Stanford. And these wildfires are not your campfire. They've got toxic air pollutants. These sites after fires, people go in hazmat suits. They wall them off. People can't just go walk around at a fire site, because fires now involve buildings and plastics and paint and toxins that get into the air, and we're breathing it. The most vulnerable, again, elderly, children, and people with respiratory illnesses. And these fires are kind of obviously causing asthma, but cardiovascular death, but the toxic exposures we believe are causing cancer. Stanford did a study in the Central Valley a couple summers ago about wildfire smoke and pregnant women, and it actually caused epigenetic changes in the fetuses. It also leads to preterm birth and trouble with labor. Our firefighters, who already have a 10-year lifespan, less than we do in general, average person, are more likely to die from cancer and heart attacks in the public. So how can you protect yourself? Well, it's not just your regular COVID or surgical mask for wildfires. You need special masks, and to be environmentally conscious and sustainable, you can use these reusable respirators shown on the right. I don't mean to advertise for 3M here, but that's just the easiest one to show. Also, there are disposable N95 respirators that have rebreathers to make it a little less hot and more comfortable in the smoke. Those aren't good to wear to protect other people if you are ill or have COVID, but they are good for wildfires for your comfort. HEPA filters are good for your home in an enclosed room. And there are lots of apps you can get for your phone, like Purple Air and others that can show you what these levels are in your community and explain to you what should be used or not in those situations, or if it's safe to go outside. We also have the other side of the spectrum, especially here in the West Coast. Again, we're getting the wildfires in the summer, and now we're getting the floods in the winter, as a lot of the other parts of our country and world have experienced always. This increased precipitation and flooding is, of course, leading to more injuries and deaths, even drownings, increased risk of infectious disease, and contaminated water supplies. And the irony is people are getting dehydrated when they're surrounded and drowning in water. After the flood recedes, mold grows and people have severe allergies and issues with mold. And of course, there's always long-term psychological and physical effects from something as severe as these types of floods. And that leads us to talk about mental health. Mental health is a really big part of climate and health. People who are experiencing these climate events are getting post-traumatic stress disorders. People might have depression about losing things, might even be depressed about things they feel they're going to lose. We have something called eco-anxiety, which is a term kind of coined about people feeling anxious about what's happening with the environment. It's not considered a mental illness to have eco-anxiety. It is considered a normal reaction to an existential crisis. Domestic abuse, substance abuse, and suicide are all on the rise due to changes in climate. And complicated grief is something that humans haven't really evolved to experience, losing everything at once, like such as in a fire, losing your home and your job and your business and your community and maybe a family member or a friend. So it's a tough one. We do see the increased suicide is related directly to heat. So these studies have been done all over the world. It's not just a summer in the US thing about kids or being off from school or those kinds of things. It's definitely associated with the increase in heat. We also see increased violence when it's hotter out, but this is greater in poor neighborhoods and in older housing, probably because they don't have air conditioning or crowded conditions. But this study from a US inner city shows an exact correlation with violent crimes and high temperatures. You might feel too, like when it's just really hot, and you just can't cool off, it does feel aggravating. And we are looking at what hormones and what neurotransmitters are being affected by heat and why people feel more violent at that time. We also see increased violence and disease in refugee camps. Climate refugees is a big issue now. There's currently one person in the world displaced every second. Every second, one person is displaced due to climate change. We think there may be up to 1 billion people displaced from their homes by 2050. And this is happening everywhere, even in the US. And people are moving because they can't live where there's wildfire smoke, or their house has been flooded 3 times, or other issues. So this is not just happening somewhere off in the Middle East like this picture. This is happening everywhere, and it could happen to us. Some of the causes may be obvious to you about climate migration, but they're both acute and chronic, with flooding or maybe the East Palo Alto sea level rise we talked about. Where do those people go? They don't have a second home. They don't have money to just buy another house. We have extreme storms and wildfires, of course, heat, drought, desertification, something that's happening in places that are trying to grow crops, and it's basically becoming a desert. So it leads to no food and famine. But let's look at my space too, the effect of healthcare on climate. So as a physician, I took an oath to do no harm. And yet we are doing harm to people's health by just the running of healthcare in the US and throughout the world. The US contributes healthcare contributes 8.5% of greenhouse gases in the US. Now, worldwide, medical care contributes about 4.5% of greenhouse gases. So US healthcare is responsible for over 1/4 of the world's greenhouse gases just from our healthcare. So we are the worst in the world. Our hospitals also expend twice as much energy per square foot as other office space because we're running 24/7. We have equipment in the ICU, operating rooms. We're very energy intensive. We also have a lot of toxic waste and even some toxic emissions, even though there's been a big ban on most of the incineration. Practice Green Health is a group that works with hospitals to try to decrease their carbon footprint, and Stanford is working with them to do so. I'm actually also working in ophthalmology on reducing our waste. I'm an ophthalmologist by training, and we have developed a whole website and initiative worldwide. But also climate is affecting healthcare. As I talked about at the very beginning of this talk, your healthcare might be affected by climate change. We have these extreme weather events that are leading to supply chain shortages and delays in delivery of drugs and equipment. People are having decreased access to chemotherapy, radiation treatment, and surgery. And even with our backup generators, they don't last for more than a few days. So with power outages, we can be without power. And this has happened at hospitals. So we looked at, there's been some studies about extreme weather events and disruption in patient transportation. People just can't get from their home to appointments. And with cancer patients, they've noted that there has been decreased overall survival in the cancer patients that have had a climate event disrupt their transportation. But Stanford Healthcare and other hospitals throughout the world have made sustainability commitments. There's a national pledge in the US that Stanford has taken, and it's working on all of these issues, their energy emissions and water, trying to reduce that to get neutral actually by 2025, as well as transportation, and to get to zero waste. We've already implemented sustainable purchasing of our supplies and looking at design and construction that is within sustainable guidelines. Lucille Packard Children's Hospital, if you ever get a chance to go, they are a LEED Platinum building and very beautiful one also. So Stanford is working with Practice Green Health and other consultants on doing all of these things. And it's not just some empty promises. There are really quite a few plans that are being actively followed that are in place. And Stanford's putting out research also. So some of the latest research done that you may have read about in the Stanford reports and news. Earlier in 2023, there was a study came out about easy diet changes, lowering your carbon footprint from a Stanford medicine study. And this didn't mean going completely vegan overnight. It was things as simple as replacing beef with chicken in a burrito, or choosing a plant-based milk over dairy, not eating meat one day a week, replacing things with legumes. So just making some simple changes could really make a difference in our carbon footprint. On the flip side, Dr. Christopher Gardner just came out with a study that showed identical twin research indicating that a vegan diet improves cardiovascular health. This is actually now a documentary on Netflix, You Are What You Eat, and it's kind of fun to watch, or you can read the articles. But it's kind of a win-win with improving your personal health and improving the health of our planet by eating a more plant-forward diet. We also at Stanford are helping youth with eco-anxiety. There have been reports of teenagers who are climate activists taking their own lives after feeling helpless over the climate crisis, feeling alone, feeling that the government's not doing enough, and that their lives are hopeless. So it's very sad about these kids. So Britt Ray, who got her PhD at Stanford and is now on faculty in our Department of Psychiatry, she wrote a book called Generation Dread about kind of the Gen Z and younger people dealing with the climate crisis and finding purpose and a way to deal with it and be active and not get depressed. There's a newsletter every month comes out through Stanford, Gen Dread, and it's got a lot about ways to teach kids about climate emotions, and just give them outlets to help deal with this issue. We also have the School of Sustainability at Stanford, but that has been a point of a lot of controversy, especially recently. Just came out in the Stanford Daily a couple of weeks ago, discussing, which we've all known about, but discussing how fossil fuel companies are funding research in the School of Sustainability. And in fact, between 2011 and 2023, fossil fuel companies contributed over $68 million to research at the school. Now, this school has been funded with over $1 billion of private contributions. So 68 million is a small part of that maybe we could fund with our own contributions or from non-stakeholders, but we are all stakeholders, but just from us ourselves and not from fossil fuel companies. We know from medicine, from our research in the medical field, that pharmaceutical industry funding of clinical research has been strongly associated with pro-industry results, as well as evidence of trial design and publication bias. So there's a whole movement at Stanford called the Coalition for a True School of Sustainability, which many of us as physicians are supporting the concept of not taking funding from fossil fuels for research. So kind of another question, but you don't have to answer in the chat. You can just think about it. So say you're diagnosed with lung cancer. What would you do? Deny it? Just give up? You know you're doomed? It's over? Reduce your smoking by 1 cigarette per day and hope things don't get worse? Or solicit money from tobacco companies to develop new chemotherapy so you can keep smoking? So I kind of feel like that's many of the responses we're having now throughout our population: denial, giving up, doing something little and just hoping nothing gets worse, or as the School of Sustainability is doing, kind of taking money so that maybe fossil fuels companies can keep polluting. So you can think about that and decide what you think. But John Dewar, who gave the majority of the money to the School of Sustainability, he thinks that we need speed and scale. This is the decade that will determine our fate. The Intergovernmental Panel on Climate Change states with very high confidence that the risk and adverse health effects from climate change are going to escalate. And these damages and deaths are going to disproportionately affect the poor and the least developed countries. And to keep within this 1.5 degree C limit, which we're not even at, and we're already experiencing a lot of extreme weather events that are causing a lot of harm, we've got to reduce our emissions by at least 43% by 2030 compared to 2019, and by at least 60% by 2035. I'm sure you can quote other statistics somewhere. These are just the ones I've gotten, but the bottom line is we need speed and we need scale, and we need to do something, and we need to do it right now. And we, in order to do that, we really need to imagine our future. I haven't really ever done this in a talk, but I think that I've read just recently, if you don't imagine what you want things to look like, you can't really achieve it. You got to see your goal. So, I don't think any of us want the world on the left, but imagine we could get to a world where we've got renewable energy. We are living within green space, within nature. We have a beautiful way of living in new designs. So I think if we can imagine a better future, we can get there. There's something now called doomers. People, we're getting labeled as people that just think climate change is doom and gloom, and so we're trying to say, don't be a doomer. We've got to have some hope, and we've got to imagine the future that we want for ourselves and our families. And there are things to give us hope. We have win-wins already for climate and health. It turns out that towns with EVs have decreased emergency room visits proportional to the amount of electric vehicles. So this has been published, and I'm sure Palo Alto is one of those towns. So, these changes that we're making can work and are working. And to be part of that movement, you can join us at Stanford. We have for students, Sustainable Stanford. There are classes you can take. We have an environmental justice working group who welcomes everyone. The Gigaton is a newsletter put out monthly by the business school, which looks into green businesses that are actually also very good for all our health. Stanford Climate and Health is a group started by medical students, but anyone interested can join, including alum and anyone else. We have Stanford Alumni and Sustainability, and of course, Stanford Alumni for Climate Action. So hopefully you'll join us at Stanford. Or if not, if you're not from Stanford or don't have an interest in that, you can join or donate to another group. Feeling alone is the worst part of this, at least if you're part of a group all working to shared goals. That's very much better for your mental health. We have Physicians for Social Responsibility, and You can join them if you're any type of healthcare worker or just support them. Medical Society Consortium on Climate and Health, Climate Health Now. The Natural Resources Defense Council, which was started to really protect our animals and natural resources, has a whole division now working on human health. 350.org, Citizens Climate Lobby, and Climate Action Now are just a few other random groups that you can look into. I'm sure there's a lot of other great groups out there that are local or that I don't particularly know about, but these are just some ideas. But definitely vote. Everyone needs to vote. It's the most powerful tool to protect our patients and solve the climate crisis. The people we elect are going to determine if we have clean air to breathe and a safe climate to live in. You can see the doctor on the left has this badge. This is called voter, or kind of vote ER, a little pun, and it's just to help people register for vote. It's nonpartisan. It doesn't tell anything about how to vote. It just says, please it's to register to vote. And physicians and healthcare workers are just trying to say, please vote for your health. And set an example. So the Washington Post came out a couple of weeks ago too, hot off the presses, the surprisingly simple way to convince people to go green. So it looked at 6 interventions that change people's pro-climate behavior. And it turns out social comparison, or kind of peer pressure, or what your neighbors are doing, is more effective than even financial incentives. So it looks like, maybe like smoking was, it's less and less acceptable to smoke. It just kind of hits a tipping point where people, oh, well, this is the norm now, or this is what my neighbors are doing. Maybe I should do it. So setting an example is really important. So if you think you're just doing something, you're 1 in 8 billion, and what's the difference? You're actually setting an example and helping to influence a cultural shift. And you can discuss health with others. People are afraid to bring up climate change, and only 14% of us think that other people care in the US, but actually 75% of people do care. And the most accepted approach to discuss climate change is actually through a personal health lens. So if you don't even have to say climate change, you can ask someone, was your family affected by the wildfire, or share your story about how the flood caused you to lose your car. But just bring it up through a personal health lens, and that's a great way to have a discussion without feeling contentious or political. We have resources that you can get if you want to talk about climate and health with other folks. Yale has a pamphlet out on beliefs and attitudes in the American mind. We also have Climate RX to help people talk about climate and health. The Medical Society Consortium on Climate and Health has information, and Healthcare Without Harm has slide decks and things you can use to talk about it. Or if you're in healthcare, you can get some ideas on how to green healthcare. But what can you do yourself? We just put in the Stanford report 8 simple but meaningful things you can do for the environment. And so while we're wrapping up here, if you want to just think of something that you can do this year or tomorrow, or a little change in your life, put your action in the chat. Just put a pledge in the chat. I'm going to vote, or I'm going to talk to my neighbor, whatever it might be. I'm going to compost. And just write it in the chat, and we'll check that out. And here's just some ideas maybe on what you want to put in the chat or what you can do. Just advocate, educate, vote, and even go out and protest. Set an example. Green your home and appliances and workplace. Eat a plant-forward diet and don't waste your food. Compost it. Drive less, use an EV if you have to drive. Supporting education of girls is really important. You can vote with your wallet, prepare your community, and even enhance your alma mater. And what I mean by that is, a few years ago, I was at a meeting with my physician for social responsibility environmental health committee, And the other doctor said, we're doing all these things at UCSF and we're teaching our med students and we're greening our hospital. What's going on at Stanford? And I said, I'm just an alum. There's nothing I can do. Well, I thought, no, I have to do something. So I met with students and faculty and we got a meeting with the dean. And he said, well, who are you? And I said, well, I'm an alum and I'm really upset that UCSF is doing this and we are not. And I'll tell you, that got his attention more than any other part of the discussion. And the rest is history with me now on faculty teaching climate change and health at Stanford. So you can make a difference even at your alma mater. So do these things because we must protect our health. And while you're at it, let's save the polar bears. Thank you.
And thank you, Barb. I mean, that was really enlightening and kind of daunting. And I think we do have to be hopeful and engage in some way. You mentioned to me earlier a New Year's resolution, something you're doing every day.
Oh yeah, let me show you what I'm doing every day. So my New Year's resolution this year, even though those are sort of always a little dangerous to do, is to take a photo every day of something that in nature that I think is worth saving. So, oops, I'm sorry. So every day I'm trying to take a photo of something in the natural world that I think is worth saving because I don't want to be a doomer. And I know we can all go there with, oh my God, everything's going terribly. And so I just take a picture every day of something we're saving. And I was on Stanford campus and I saw poppies, which on the right is our normal orange California poppy. And I found a whole albino poppy plant. So I thought, wow, that is worth saving.
I think that's a great idea. I mean, one of the things that I find in my life important is connecting to nature and not separating ourselves out from nature. Where I work in Alaska, it's a kind of a small area and a kind of confined ecosystem where we see the effects of climate change, and one change affects the entire ecosystem. So how do we find that connection? I am very connected to the bears and the salmon and that ecosystem of the Brooks River in Katmai, but how do I in New Bedford, Massachusetts, how do we in places where we live reconnect? Because we're not alone. It's not just us humans and then everything else.
Right, right. That's so important to remember. And I also wanted to share with you something, it's not just about, concentrating on our human health. There's groups started now called One Health. It was started by veterinarians at UC Davis, I believe. And, it's putting human health, environmental health, and animal health have to all go together. We can't just help and save human health without looking at these others. We're all, like Naomi said, we're one ecosystem. We are part of nature. We're not separate from it. And we cannot survive without the other components being healthy also. Stanford does have the Woods Institute for the Environment, which is concentrating on human and planetary health. I wouldn't even separate the word human. I would just say planetary health, because again, we are part of it. We should not consider ourselves separate.
One thing that I feel like we don't talk about very much these days and used to talk about, and that's population. How does population fit into the climate picture?
Yeah, population is something that's kind of the elephant in the room, or something people won't talk about. But we should be talking about it because there's a study that CO2 emissions could be lowered by 30% by 2100 just if access to contraception was provided to women who are asking for it. This isn't about forcing anyone to use birth control or pushing it on anyone. This is just giving it to the women who express a need for it. And that would be achieved, the CO2 emission decrease is actually achieved by lower population. And also for the women themselves, it's improves their health and it decreases their mortality, allowing them to space their children so that they and their children can be healthy. And also when there's heat and air pollution, that increases their pregnancy complications. So, they can actually try to be pregnant maybe when it's not as hot or, anything. So, birth control and population control are really a big part of climate and health.
We have some very interesting questions from people who are here. There was a discussion back and forth about meat substitutes. Someone asked, is Impossible Burger a better thing to eat, really? And there's a little back and forth. What do we know about that?
Yeah, I didn't actually mention that, but I figured it would come up. Yes, Impossible Burger is better to eat than a regular burger for multiple reasons, your personal health and the planet's health. Now, is Impossible Burger a health food you should eat 3 times a day? No, it is not a green leafy vegetable. But if you are craving a hamburger and you can substitute an Impossible Burger, you will not raise your cholesterol and you will have 20 times less impact on greenhouse gases. People freak out. It's processed. It's a processed food. Well, the cow is processing plants into protein too. So meat is actually processed by the cow eating plants, and Impossible Burger is processed by combining plants. I actually got to go to the factory when it was new in Redwood City, and they made it right in front of me, like by hand, just mixed oats and coconut oil and whatever it is, mixed it up by hand, like your mom would do in the kitchen when you were a kid with the meatloaf. And that was it. It wasn't some horrible chemical processed weird thing. So again, I think that the meat substitutes are great if someone eats a lot of meat and is craving meat and doesn't want to give that flavor or texture up. But again, it's just the enemy of good is perfect, or perfect is good, or good is perfect. We don't want to say, oh my God, that's evil, just eat regular hamburgers. I mean, that's not the answer.
So David Kenny had an interesting question. Have you seen any indication that these health impacts are helping to sway policymakers who have been resistant to passing the kind of aggressive policies we need to save ourselves, like carbon taxes or strict regulation?
Yeah, so actually with the Medical Society Consortium on Climate and Health, that's really what we do is we do advocacy to politicians. We work on letters to them we just worked on changes to the farm bill that we suggested. And the politicians actually do listen. If you tell someone that the people in their constituency will have more asthma attacks, that their healthcare bills will go up, that their hospitals won't be able to handle the load, that people are going to be upset if they don't have clean water. They actually do listen. I mean, if you start with the polar bears, forget it. But if you're talking about the health of their constituents, we do get them to listen on both sides of the aisle.
And we had another question from David Smeroff. We need to get the money out of politics, including fossil fuel money, and if we have any hope of consistent and meaningful public policies to protect human and environmental health. And so how do we do this? How do we, get, make these changes, get enough money without taking money from fossil fuel companies?
Well, I think David probably knows the answer better than I do to that. I don't know. Someone had the idea, I think it might have been Janine, that, instead of the doer school having to get that money from fossil fuel companies, could alums say, hey, if you don't take money from fossil fuel companies, I will donate money to you. Or if you continue to take money from fossil fuels, I will not donate money to Stanford again. I mean, I don't know the best way to get the money around or make these governmental changes, but I know that talking about climate change through a health lens is the most effective way to do it, and that physicians, healthcare workers, and anyone who has an interest in their health or their family's health, needs to bring it up in that way. And we're hoping that studies have shown that that is the most effective way to make these changes. But money and politics get pretty sticky. So if any of you have other great ideas, that would be welcome.
And related to that, Yao Peng Leong, I hope I have not damaged your name too much, that said that going green is expensive, right? And we're in a developed country, supposedly. How do we help, or how do underdeveloped countries tackle this issue?
Yeah, I mean, that is a big issue, and that's been going on at these COP, conferences, that these underdeveloped countries or developing countries, island nations, they're in big trouble. I mean, the people that have caused the most climate change, which I'm, a part of, the people with money and privilege and live in the US, have caused the most greenhouse gases and climate change, and the countries that have caused the least and people have caused the least are suffering the most. So, getting funding to them. I mean, this has been discussed at COP28, COP27. Can developed countries give aid and give money to developing countries to help them deal with their sea level rise and their droughts and their lack of food? And we just, I think we need to step up and do that. But they really can't pull themselves out of this. I mean, if you're a poor island nation and your sea level's rising and you didn't even really contribute to the cause of that, I mean, we need to help those people out.
We're running out of time, so I don't think we can get to any other questions, but we will send Dr. Erny your questions and try to answer them. This wonderful evening has been recorded, and anyone who is registered will get a link to that recording in a week or so. And then we will also have this on Stanford Alumni for Climate Action YouTube channel. So I really want to thank Dr. Erny for a very thought-provoking and informative evening. I have a lot to think about, including what my New Year's resolution will be for one thing to do each day. And I want to thank everyone for joining us, and let's continue the discussion. When this is on YouTube, please put your comments in, and we'll check it and see if we can continue this discussion. And be sure to join us on March 7th when we present Harvard beats Stanford. Oh no. Activating alumni to beat the climate crisis. And then on April 4th, Doctors Daniel Swain and Noah Diffenbaugh will join us in a conversation about climate change in California, which should interest a lot of you. So thank you again to everyone. This was a great evening, and thank you to Stanford Alumni for Climate Action and Stanford Alumni in Sustainability and the Alumni Association and everyone who came.
Right.
Have a good evening.
Go out and set an example and don't be a doomer.
Yes.
Thank you all for coming.